Good evening and welcome to the Warwick Manufacturing Group here at the University of Warwick. And of course, I welcome you on behalf of the West Midlands Health Informatics Network that is supported by the West Midlands Academic Health Sciences Network, which probably you have heard, that does quite a lot of work in the region, and is hosted by our group, the Institute of Digital Healthcare, which I'm heading the research, and I'm a professor of e-health innovation, according to the title. So we have a nice group of people from our medical school and other medical schools in the region. I think it's Birmingham mainly, and Warwick. So again, a very warm welcome. Today's evening is very informal, and I had already one beer, so if I slur, it's the beer. And the idea is that we discuss a little bit about the work we do in the institute and also in the region concerning medical and health informatics. It's mainly a few talks from our group, and you will meet some of my colleagues. And it's just for inspiration and for bringing the discussion. We hope this will be the first of a series of meetings that we want to do for the future clinicians, the current students of medical schools, and also some of our junior doctors. We're planning to do another event with our junior doctors at hospital sites because, as you know, you junior doctors have a very busy schedule. Although I admire you medical students because you have a very busy schedule as well. And hopefully at one event we'll try to mingle both groups. So hopefully we'll have a few more of these. And I would appreciate your thoughts on what we discussed today. And again, because this is for you, anything you want to discuss or for us to organize, please let us know. So I thought I'll give you a little bit of an introduction of my view of how medical informatics have changed the face of medicine. I'm supposed to stay still, but I like to move around, so I hope the camera is not very upset with me. Supposed to work? Come on. Yeah, there you are. I have to swipe, so it doesn't like it? There you are. Right, so informatics. Now, this is interesting, and you're probably experiencing this as medical students and also from any clinical practice. I presume you are in different stages of your studies. Some of you told me you're on second year, some of you towards the end. So what is interesting is that I think the way the healthcare system is working has a bit of fragmentation. And we tend for academic and other purposes to kind of create silos. What we hope to do with medical informatics is if we want to achieve integrated care across the silos, it is very important to look at the effective use of information. And this is what I'm going to try to discuss in my presentation. Now, this is an engineer's view of the healthcare enterprise. Actually, we still have the patient in the middle, in the center of everything, but what we are interested in is that kind of connectivity between the different stakeholders and the different structures in the healthcare enterprise, but most importantly, that connectivity is about the exchange of data and information. And I think it has become quite centric in the field of medicine. And of course, I don't know if in the curriculum you're formally taught medical informatics, are you? I used to do one session to the medical schools at the University of Birmingham, but that was about a few hours where I was talking about these things. And Sarah, you used to do some of that. But I think it's interesting because as technology becomes more and more important for the clinical practitioners, this has become a bit of the center of how technology supports clinical practitioners. Oh, I'm going the other way around. Oh, okay. I'm learning. I'm not very good with technology. So this shows you the kind of breadth of data we tend to collect during our everyday practice and as part of the healthcare enterprise. And I won't go into the details, but it's interesting how many of these things probably you recognize. And there are some interesting things like stuff that comes outside the very confined healthcare sector, board level papers, so the administrative part. So we have a plethora of data and information that is available. So this is the kind of challenge and the kind of opportunity we have with health informatics. And this is the vision that we see from our government and our structures. So the view that in a few years, by having the patient in the center and connecting all our healthcare exercises, we'll be able to integrate every possible solution around the needs of the patients. And technology is very, very important. Now, how many of you have dealt with electronic healthcare records in your... Okay, and what is your view about electronic healthcare records? Maybe if I try to make this interactive. Yeah. Yeah. And I presume primary care is on the center of that, so a lot of the workflows depend very much. The electronic healthcare record is important in that. So what is your view? I presume you are a student? Yeah. Yeah. Great. So there is the power of information, the power of connectivity gives us that opportunity. Now it's very interesting if we look at the that ubiquitous connectivity that we have available. This is the perspective of the government about how we use that connectivity and that power of information as patients and as citizens. What is interesting is, I don't know, these are about 2 or 3 years old, but 50% of us probably use the internet to self-diagnose. And that's probably an interesting challenge for you as current clinicians, future clinicians, how to deal with that interesting challenge. My GP hates me, okay. I've trained as a clinical scientist myself, and it seems my knowledge is very interesting, and because I like evidence-based medicine, I go and challenge him, and he says, go away, I don't like you. You just make all these decisions. Why do you come and see me? Just to torture me. So that's my approach. But that's interesting that as things are changing, we are, 80% of us like to have access to our medical records. How many of you have access to your medical records? Am I the only one? I'm annoying my GP. He gave me access to my EMIS web records, and I go and I make appointments and I demand my lab results, and I go and argue with him because he tells me, oh, this is all right. And I said, in what sense? And I see this and this. And so there you are. So that's, but what is interesting is that in the future, potentially, we might be able to share medical records. I can tell you a personal story. I had an injury in my shoulder, and because that injury was creating radiating pain, I thought it was heart problems. It took about a few months to be referred, and after we did a variety of examinations with ultrasound, etc., we found that I need to go to a physiotherapist. I arrived to the physiotherapist, and he said, can you tell me what your problem is? And I thought that's a very nice way he tries to approach me. He wants to engage in discussion. I said, well, as you have seen from the notes and the record, he said, no, I don't know anything. I haven't seen any record. There was a letter saying you're arriving with this condition, but I need more information. So there you are. So there wasn't a share of information across the services. And of course, I think it's interesting because this was 2 or 3 years ago. 73% of the UK population access the internet. Apparently now is 86%. So it's amazing. So it's going to make things very, very different. I'm not doing this right. Right. So from a perspective of what medical informatics is, or medical information science, this is what we engineers, computer scientists, informaticians think it is about. And you can see it is about having a way of thought, a deductive way of thought, through algorithms, developing particular procedures for managing, process controlling, decision making, and scientific analysis of medical knowledge. And this is from a guy, Ted Shortlift. He's a guy who developed the first AI program in medicine many, many years ago, and he's still a professor at Columbia, I think. And I have a lot of arguments with him when we meet at conferences. But it is about how we acquire, model, represent, and manage medical data, information, and knowledge. That's what medical informatics is. I need to learn to do this properly. And if we look at the history, it was about organizing the knowledge or the information we had in terms of how we index information, in terms of disease classification, or a lot of the work was about the literature and the knowledge we were developing. So the Index Medicus, then we had a specific system for analyzing literature and information in medicine. Then we started moving to things like information systems for community health, and the MySyn, the first decision support system that was developed by Shortlift, and then other things that led us to information and classification systems for describing the knowledge in medicine. So this is how it started. It was about how we organize knowledge in a systematic way. A lot of medical informatics started from librarians. So that's really where everything started. What is interesting is that I'm not doing this right, even in 1966, we used to I like this because my professor in information systems at my first degree showed this as the state of the art at the time. But I didn't do my first degree in 1966. I wasn't born in 1966. But he used to say that, how we used to look at the future, connecting all these devices for being able to look at heart monitoring. Now you have seen how EEG and ECG devices work, very simple to plug in for ECG. For EEG, which is also clinical EEG, can be more complex. Now we have EEG devices that just wear and you do your measurements, etc. So that's how things were working in the future. And this is Shortlift's program, which was a program where you could put information, input on a set of statements, information as ones and zeros, yes or no, to be able to come to the diagnosis. So as early as 1970s, when I was about, I think, 3 years old, this was working. And this is part of the history of medical information systems. Now, it's very interesting because informatics is very close to what we do as human activity generally. So usually we tend to observe, then collect data, then we analyze this data to do reasoning, and then we act on that. If we are scientists, we call it measurement theory and experiment. In healthcare, you collect patient data, you act on it, in effect you reason on it to be able to do a diagnosis, and then provide a plan for therapy. And of course, computers do it in a similar way. So I think these are the three important components in the whole area of medical information science, that we collect data from a variety of sources. This is what we call the progenitors of information. That data then is inferred, and then from there we can derive useful information for through the interpretation or reasoning. And then that collection of information, when it's filtered, becomes the new generation of knowledge. And I think during your studies, you go through that, but you learn how to do the other two important steps. And I don't know how to do this properly. And this is what I think they teach you. Tell me if I'm wrong, that this is the steps you're supposed to do as doctors. Do you agree? Disagree? Okay. But this is how we informaticians look at these steps. Okay, we collect the data from the patient as part of the observation, and we reason on that as information. Then we have diagnosis as part of the decision, and then plan. And both therapy and both diagnosis and therapy are inferred as part of this knowledge. Martin tells me I'm late, and I'm really coming late, but I have about another 4 minutes, Martin. Okay, great. And this is how we informaticians have created this simple model of how data, information, and knowledge works. So medical information science is about these three things, and is nothing special. Now, what is very interesting in this time of an era is that we collect quite a lot of data. So that interesting cycle you saw there has a bit of a problem, because you have a lot of information that needs to be induced from a lot of data points. So we have this problem of big data. And actually in medicine, you have been told most recently, maybe during your studies or during things you're doing, that you have quite a lot of data to deal with. Genomic medicine, all the omics, a lot of self-monitoring, sensors, devices, and we come with our vision that we can instrument hospitals, people, everything, and we can collect a lot of data. This can be interesting, but it can be a challenge as well. So why it is interesting? Because you have what we call the 3 V's. We can have, in terms of healthcare, structured or unstructured data, and we have an interesting variety, from clinical notes to audio to transcription to imaging to streaming. Then this is often time sensitive, and we might analyze it immediately when we collect it, or later on as part of the exercise. And of course it comes in large quantities, okay, in volume. And GPs collect quite a lot of data over a lifetime. So that's interesting. Now, digital pathology, all the omics, equally, GPs use email and web communication, virtual clinics. All this data is part of this exercise. And what makes it more interesting is that we have the volume, velocity, and variety, but we have veracity as well. A lot of data has inconsistency, a lot of incompleteness, ambiguities, and this is the challenge we have as informaticians, and also you have as clinicians, is to understand that complexity, and this is what we try to do. So big data is something that is a new thing in informatics, and if we look at an integrated approach to healthcare, there are interesting keywords that we use as part of our way of doing the healthcare enterprise that show us where particular elements of big data come. So in terms of the personalized medicine, how we collect all the omics data to be able to plan individualized treatments or be able to give the choice to patients for their preferences. And this is an interesting thing because the world is changing instead of the medical-centric, as the medical professional being the center of delivering particular approaches to decisions, we engage more the patient, and that's quite interesting. Okay, it's a beer, I haven't. But to be able to make this data to work, we need to be able to make it work not only for the understanding of humans, but also of computers. And this is the magical word that I use in my group, and they penalize me every time I use it, so I'm not going to say it, but it is the concept of interoperation. But the data needs to both interoperate in terms of communicating and be able to be available within systems, but also be understood by humans and machines, have meaning. So we call this interoperability, and this is very, very essential. Now, the technical part is like that. Now, I don't know how many of you have ever used VCRs or video devices. I still have one because I still have old videotapes. And what was worrying, when my daughter was 2 years old, she was able to connect things more easily and operate it than I could. But it's about this aspect, but also it is about the aspect of be able not only to exchange information, which is about the connectivity, but also to predictably use the information. It is about meaning. My colleague Sarah is going to talk more about this interoperability aspect in the future. But this is how I think it works in terms of medical information systems. At technical level is how we transmit the data and how we format it and store it in computers. At a logical level is how we create models of the healthcare enterprise or particular pathways to disease or to therapy, then how we use a language that is common, and then how we present the clinical context that both computers and humans can understand. And finally, at the application level, at least from the point of view of systems, how they function and present the information so that you clinicians can make decisions. So that's really how we see that interoperability being essential, and that's a center in medical information science. I'm finishing. So this is how it's going to look in the future, and you can visualize yourselves there with all the information and data collected from real time, visualized in a particular way, having actual physiological information. I love that part because it says brain analysis. We do a lot of connectomics work and functional structural connectivity of the human brain. It takes us ages even to create a simple graph of connectivity, because we talk about very large data and very complex calculations. But apparently this doctor, who looks extremely happy to operate like that, I like these pictures. This happens in almost real time. So gazing into the future, I think this is where it is important from your perspective. You are in this domain, isn't it? And what is interesting is that you have all these different types of data. Here I just identified a few as part of these. But by collecting it, or streaming it, acquiring it, organizing it, analyzing and visualizing it, you're able to execute towards medicine that is not the average effect, but is stratified and personalized. That links back to research, to the creation of evidence, the creation of knowledge, and of course makes the patient equally accountable as you are. So the patient use this information to be able to work with you clinicians to achieve that. So I hope that this is what is going to be the future through the use of technology for clinicians like you to achieve better outcomes for the patient and the citizen. Okay? And just to make it more interesting, I'm just going to look at what Shortcliffe and James Cimino have said in the latest edition their book, which again, if you want to learn more about medical informatics, it's a nice book. It's quite thick to read. It's a nice bedtime reading, or you can use it to hold the doors. Is a good doorstep. But it's interesting how they look at this from a different perspective, and in particular, looking at your end, that medicine is changing. You have different starting points, and your computer literacy or your technology literacy allows you to do a lot of interesting things. But the industry is becoming more and more competitive, and we need to be able to manage our information as well as we do it in other areas of our enterprise, human enterprise. And here, hopefully, we will be able to take that challenge and improve both financially and clinically in terms of outcomes what we do in healthcare. Saying that, the digital adoption and the adoption of technology in healthcare is the second worst in all industries. Did you know that? And do you know which one is the worst for adoption of digital technology? Can anybody imagine? The maritime industry, they don't need it, but there you are. So, okay, so that was it. Thank you very much.